Where did you go? All right, here we go.
It's not. Oh, yeah. All right. Share screen. Hello, everyone. Hi. How is everyone today?
Good.
Good. So, Denise, I can't hear you. Are you guys muted at the moment?
Yes, we are.
Okay, but that's working. And Buckport, are you guys, it's fine, yeah. And Nicole, can you hear me?
Yes, I can.
Perfect, great. Oh, that's it. Yeah.
Karen.
Karen.
Even though that's, well, he's got his speaker is muted. Is that on our end or his end? Yeah.
How do I get out of the chat?
Person who signed in as Karen has their mic muted.
Yes, I understand that. I'm trying to get on the telephone and trying to find a phone number. I can't find the phone number, so it's a little bit frustrating.
Okay.
Oh.
Do you want the phone number? We can give it to you.
That would be lovely.
Okay.
Would you share that, please?
Yeah.
Yeah, we can hear you just great now, too. Great.
I'll
Thank
bet you can.
Sure. Sure. Okay. The number, ready?
Yeah. Yes.
Is 1408 638 0968.
That's not a phone number. Could you read it back to me again, please?
So it's area code 408
Uh-huh.
638.
638.
Yeah, 638-0968.
Okay, hang on a second.
And then I'll give you the meeting ID.
That'll be wonderful. Hang on.
There's a way you can change it, but it just makes sense.
Welcome to Zoom. Enter your meeting ID followed by the pound or hash sign.
So, the meeting ID?
538 993 426.
Enter your participant ID followed by pound. Otherwise, just press pound to continue. You are in the Zoom meeting now. There are over.
Hello?
Okay.
So you
Can
should be able to hear me now.
We can hear you.
Yes,
Can
we
you hear us?
Yes, we can.
Beautiful.
Okay.
Good.
Right.
Great.
And so on the calendar invite that you had, you didn't see any of that information?
And no, it's not that. I have a complicated calendar, and it's hard to get it through OWA, which is how I have to get it on this laptop. So I had this all set up and couldn't find what I needed. So, of course, I was struggling with it over and over again in front of you with the camera, which was the best way to do it.
Okay.
Okay. Sounds good. And so, so we don't have a visual on, let's see.
Yeah, my computer doesn't have visuals.
Is that, okay.
How did you get ahead of me? I just saw you go in the video office. You did? I looked around the other end. Are you here or there or where? I'm here, but I don't move over here. Here. I'm just very clever, you know. You can not what I've ever been. You just look like me. I had to go downstairs. I had to go downstairs and get one of these when I came back to my office. Grab my sweater because I realized it would be cold. I'm hoping if I sit way over here, they can't. Well, that's why I.
You can use mine.
No, honey.
You can use mine when you talk.
So we're not using this. Especially all bundled
Yeah,
up.
but when you talk, you get your own personalized space. So have a seat. You can use mine.
Cam's here,
Set up.
mostly. Now at least I got there.
Yeah.
All right, everyone. Oh, I'm sorry.
Okay. Yeah. Yeah, we're getting everybody on and we're figuring out a couple minor bugs for some people. When you talk, you're getting this back. They saw that.
Oh, what the heck happened here?
Right. Is everyone online? Can everyone see my screen, the PowerPoint?
Yeah.
Okay.
Oh, so happy down. Got home early yesterday.
We're gonna start in about 5 minutes. Waiting for a few more people to get on. Had another couple of people joining us. And those who just joined, can you hear me?
Yes.
And can you see us?
Yes.
Okay, thank you. We're going to wait just another minute and get started. All right. Can everyone hear me?
Yes.
Yes.
Yes. Okay. We're going to get started. Good afternoon and welcome to the first of our Learning Collaborative webinar sessions. I'm Linda Eichhoff, a project manager for GWEP, and I'll be facilitating our webinar scheduled over the next 10 months. We're going to do a roll call in a little bit, but first I want to introduce our team immediately here and make sure everybody's got good visuals, and then we're going to go through a roll call and see who else is joining us today. So I'm Linda Eichhoff. I have with me Brett Oliver, Debbie Johnson, Dan Moran, Tim Hesselt is Tim, I'm sorry, and Ellen Flaherty, our PI and leader. Great. So thank you, Linda, and thank you, everyone, for joining. We are really excited about virtually spending the next year with you. I think what we hope to see happen is that at GWEP, we say we're trying to help folks to make it easy to do the right thing. So we're here for you. We are on this journey together. And I think that it is, very exciting that we're able to implement this in practices that are in more rural areas, that we would never be able to do this without a learning collaborative. And so I think this is really exciting. And I really want to thank you for your effort. We're going to learn together, which will be wonderful. And as I said before, we're here for you and here to help. So with that, I'm going to turn this back over to Linda, and I will speak to you soon. Thank you, Ellen. All right. So we're going to start off today's session by showing you how to get the ideal view format for Zoom. So your screen would look like this if it doesn't already. We're going to ask that you activate your chat. You'll see a toolbar, the black toolbar with the word chat. If you click on that, you'll be able to message us. You could message the everyone on the call, or just our team under facilitator, and we will address any questions, concerns, issues you have, or if you have something you'd like to bring to the group, we can share that. If there's an incoming message, you'll be notified through the orange alert, or whatever we call that. Next, activate your video if your computer has video capacity. And you'll see on the black toolbar a little arrow up, and then video. Go to that, and we have some selection on setup. And I want to mention now that we will be we're taping this call, and we will also tape upcoming webinars so that we can reference them later. I should ask before we go further, was everyone able to activate chat and video who wanted to do so?
This is Brant, and I'm starting to see some chat messages coming in, so that's great. Everyone keep testing the chat as we go. I'll respond to questions as you go through the session.
Terrific, terrific. Okay, next you'll see at the top of your screen, view options. And if you click on exit full screen, that brings you to where you can click fit to window. Everyone see that? Okay. And once you do that, you should be able to see a screen like the agenda that's up now. Are folks seeing this?
Hold. Okay.
I'm sorry, I'm having a hard time hearing someone speaking.
I'm not seeing the fit to window.
Hello.
Anyone hear audio?
Hello.
Hello? Hello?
Hi.
Is this a conference table?
It is supposed to be the conference.
Oh, we hear you now.
Okay, who am I speaking to?
This is Terry Bonstein from Lakes Region.
Okay,
Yeah, it's not the conference. We're not the conference table.
so it sounds like we lost the conference. Of course.
Yeah.
Okay. I don't have the
Right.
participant. All right, hold on. We can figure this out.
I guess we have to call back in. All right.
All right, hello, this is Linda. Can anyone of you please tell me whether you can hear me?
This is Karen Davis from LFDH. I can hear you.
Great.
This is Karen Dumont.
All right, so I'm gonna go through the practices, and please let me know you're there and who is there. Alice Peck Day.
Hi, yes, you have Shelley Friedman, Rebecca DeRozier, and Stacy Worcester.
Terrific. Belknap family.
Yes, we have Christine Farrell, the office manager, and Denny Verrill, the nurse.
Thank you. Hillside family.
Hi, Karen Dumont, nurse.
Great. Laconia Clinic, Dr. Baer's office.
This is Karen Davis. I'll represent Dr. Baer in internal medicine for the Laconia Clinic.
Thank you.
Jen Hawkins from Laconia Clinic.
Thank you. Lakes Region Family Practice.
Karen Davis for them too, in case they can't join today.
Here we go.
Okay. Bucksport Health.
We are back.
And who do we have on the line?
Terry Bobstein.
Paula from
Okay.
Maine Primary Care.
I'm sorry?
Okay.
Paula from Maine Primary Care Association.
Great,
Lake
thanks,
Region
Paula.
Family.
And Nassen Healthcare. Do we have anyone from Nassen Healthcare?
From which healthcare?
This is Nassau Healthcare.
Okay. And Joseph R.D. Decay.
This is Nicole. I'm the medical assistant. I'm here to represent both Dr. McKay and myself.
Thank you. Okay.
Linda, can we move back and just ask Nassen Healthcare again, who's here? Nassen, are you with us?
Yes, Nassau is with you. We've had to move places 3 times. We've been shut down on our computer. We're now at a different location. Sorry for the delay.
And who's in your group this morning?
Mary Gerald, Sherry Jordan.
Well, welcome. Thank you.
Thank you very much.
Thank you.
All right. So our Learning Collaborative journey really began last month with the annual Wellness Visit Boot Camp and will end in January of 2018. As we move forward, first with bi-weekly webinars, moving towards monthly webinars, we'll be tracking our progress along the global timeline up at the top of the screen. The boot camps align with each of the webinar topic phases. And for ATP and dementia, a breakout session at boot camp will be planned instead of the usual webinar. The syllabus should look familiar from your boot camp folder. It's been updated and it was attached to today's webinar invitation for your reference. As we move forward, there will likely be tweaks. Please let us know if you you should have been able to populate your calendar with the invites for each of these meetings. If you had any problem with that, please reach out to me and let me know. And with that, now Grant will briefly review webinar expectations.
Good afternoon, everyone. This is Brent Oliver. It's great to have you with us today, and it's been a real pleasure to work with this GWEP team to help design the collaborative and to work with all of you today. So welcome, everyone, and looking forward to the journey ahead. Just going to cover a few basic expectations around working in a virtual environment in a collaborative setting. Some things that generally work well to make these meetings very effective and efficient. First of all, really important to try and log on early. As we experienced early in the meeting today, little hiccups occur, audio sometimes doesn't work, or we have to adjust video, etc. Getting on early really helps us to start on time and for you to have the best chance of being fully present in the webinar going through. The second bullet's really important too. You get the most out of these meetings if you come fully prepared and ready to participate. So certainly you'll get a lot more out of these sessions if you're actively involved. The third bullet is to use the chat feature. Looks like folks are pretty comfortable with that already based on what I've seen so far in the webinar. Just about everybody has sent a chat message in. If you haven't, I'd encourage you just to send me a chat message to get used to how it works on the Zoom interface. Another thing we try and do in a collaborative workspace is to have one speaker at a time. So it'll only be one presenter talking at a time. Same thing if we're doing presentations or question and answer. We'll work to have just one speaker at a time so that everybody can hear and everybody can have a voice. On your phone lines, when you're connecting in, sometimes we can get some feedback if you don't have your phone muted when you're not speaking. So if you haven't done so already, please mute your phone if you're not speaking, and then remember to turn it back on when you do. It's happened to me a couple times when I launch into a lecture or an answer to a question and I haven't turned off the mute button. It can be a little embarrassing to find that out halfway through. So make sure you unmute when you're speaking and mute when you're not. Also, just some basic ground rules. This is a learning community. We're here to support and learn together. And it's an area of mutual courtesy and respect. So we ask for that frame to keep that in mind as we work together. We'll also be submitting data and progress reports. We think we've designed a system that will be rigorous without feeling rigorous. We'll talk a little bit more about that later. Be very low burden on you, but we'll be able to generate some really great information that will help us to learn and improve together, and also, if we want to publish on our results. And finally, we are in the spirit of improvement here. We encourage you to complete post-webinar evaluations at the end of each webinar session. They take about 1 to 2 minutes. Debbie and I tried this out the other day, and Debbie did it in a minute. So we'll see if people can beat Debbie's record today. The monthly progress report is another piece of the reporting that we'll use. This one takes a little bit longer than the after-session evaluation, but it takes less than 5 minutes. I'm fairly slow on these, and it took me about 4 when I tried it out. And another piece of good news for these is that it's just one per site. Not every participant has to do one individually. It's the whole team, one per site. And what we want to learn from these is what progress have you made, what challenges you're running into. If you figured out some secrets of success, that would be great to pass on to the collaborative. We definitely want to know about that. And what your experience is as a participant in this program. What's it like to be in this collaborative, and how could we make that better? And then finally, we have this other category that we leave without any direction at all. You can write in anything that you think is helpful or important for us to know. And we'll ask for one of these monthly progress reports per site by the end of each month. So the first one will be due at the end of May.
I wanted to mention, and this is a slide about the post-webinar evaluation. What we're looking for will be what went well, what could have been improved, overall quality of the session, your Zoom IT experience, and everything else you'd like to share with us. We ask that you complete the survey the same day as our webinar, preferably just after. And I did include in your webinar invite today the link to complete that survey. So thank you for doing that. And next, Dan Moran is going to give a little overview of the GWEP toolkit and geriatric implementation guide. Thank you.
You're welcome. Thank you. So, on our bootcamp, we reviewed our website, which you can see the address there as nnegec.org. You do have to register for the website, but again, it's a very simple thing, and that's just so we can really track who is on the website. And unfortunately, as of this morning, we've only had 8 out of 30 participants even register for that site. I'd like to see that number go up, because I think there is a fair amount of information on there that can be very helpful to our different sites. Once you log on, there is a button towards the bottom called the Annual Wellness Visit Toolkit. And when you click on that, it would take you to that site that we're looking at right here. And as you can see, there's a whole heck of a lot of information on there. As far as the AWV, there's the frequent asked questions and the ABCs. And this page is really broken down into pre-visit site readiness, pre-visit patient readiness, during the visit assessment, and post-visit assessment. Also on here, we're also going to include some information about our boot camps as far as the slides from the boot camp and different presentations that were given there. So eventually that exists on the website. Currently it's at the top of this, which you can't see here, but there is a lot of tools here, and all you have to do is click on the blue hyperlink and it will take you right to that section. Also coming hopefully soon in May, we're going to be having a geriatric implementation guide. That's the name we have for it at this moment. We'll see what the editors have to say about it, and that title may change. But as you can see, one of the chapters that we have listed here is called the Annual Wellness Visit. And this sort of basically goes through the step-by-step how to implement the Annual Wellness Visit in your practice, focusing mostly on the nurse run visit. And this implementation guide also at the end of this section has all the tools needed to go along to help implement that portion. And this will go hand in hand with our website as well. So the references are in both spots.
Thank you, Dan. I'll now turn the time over to Debbie Johnson, who's going to talk about quality improvement considerations and models.
Okay, again, welcome everyone, and I just want to echo my colleagues. It's a pleasure to be spending time with you, and we look forward to working with you over the next year. Just want to pause a moment before we do go through the PDSA review that your clinic or your organization has decided to implement the annual wellness visit, and this is already or will be resulting in some kind of change. And change on top of what we already know, healthcare being complex, people are complicated, change is hard. You're doing this heroic attempt to implement annual wellness visits into the clinic. This is a favorite quote that I like to use from time to time. It is, quote, "While all changes do not lead to improvement, all improvement requires change." And your ability to develop and test and implement changes is going to be essential to you individually or as a group or as an organization. And we're here to help you in doing that through this collaborative and look forward to that. We also want to support your practice so that you have a culture there that is receptive and working towards making improvements if you do not already have that. What do I mean by that? You're going to start small and have some small successes. I think some of you heard me say at boot camp, small steps equal small successes. And we all know that seeing is believing. We also want to work with you so you'll create and shape a clear path for your work and that you find the bright spots in the work that you're doing. Also, it is important to focus on delighting your customers. Who are your customers? Clearly, we're talking about your colleagues, we're talking about patients, we're talking about visitors, we're talking about both internal and external customers. And again, we want to work with you and hope you will have a positive, cooperative environment, and that will produce effective teamwork as you work together. And this may sound unusual, but I like to work in an environment where people are not afraid to point out where something is wrong or needs to be changed. To me, that's a positive outcome and a positive experience for folks. So, and we also know the value in the use of data. It is used to guide and make decisions. So it is important, and Dr. Oliver will be talking about that in a moment, that we have measurable tracking of data over the course of the project as well as performance data. And as I say, Dr. Oliver will talk about that. some of you were introduced to the PDSA cycle at boot camp. Some of you may be familiar with the PDSA cycle already, but I just briefly want to go over each phase of the project. Phase one, the planning phase. As you have decided to implement the AWV, many of you also focusing on the nurse run visit, you need to decide who's going to do it and when it will be done. We look forward to hearing about some of your plans to do that. You're going to make a hypothesis or guess what's going to happen when you try the change, and think about what you expect to happen as well. And then we will be working with you to help you collect both quantitative data for tracking purposes, but also be mindful of qualitative data that will allow you to evaluate your methods of change. Now, phase two is the do part. This is where you're going to carry out the change, which includes collecting data, documenting problems, thinking about unobserved outcomes, as well as starting to look at some of the data you are starting to collect. Some of you may have already completed your first due PDSA, so you would be in the study phase. This is really important. I know I said this at the boot camp, but don't get bogged down in the doo-doo. A lot of people plan for a long time, then they finally do it, and they forget steps 3 and 4, which are really important steps. So for those of you that have completed your first annual wellness visit, I suspect you're already studying that experience and reflecting on what that test you tried, how it impacted on the practice. And then you're going to use the experience of carrying out that test and the data to discuss what's going to happen next. Did you get the results that you expected? If not, why not? And did anything unexpected happen during the test? We sometimes forget to talk about that. And then you'll quickly move to step 4, which is the act. You will analyze and assess the pilot results and direct your steps for the next PDSA cycle. So this is a really refining step where you will refine your next step and what it will look like. So I would like to just leave you one pearl, and that is when you're in the act step, there are a few things you need to think about. Keep the change and quickly move into the next. Try it again, maybe with 2 or 3 more patients. Do you need to abandon what you did and start fresh? Next slide. We have developed what I think is a very helpful design worksheet, and Linda sent that out to you earlier this week, and I believe actually it's attached to the WebEx. Okay, it's attached to the WebEx as well. I highly encourage you to use this as documentation to keep track of where you are, what you tried, and it will be a nice summary as you move throughout the process. And we're going to be talking more about this, but I just want us to be mindful that PDSA is an iterative process, and that eventually leads to lots of great, what we call breakthrough results. Sequential PDSA cycles build on each other, and that leads us to a well-supported tested change. A team learns from a test. What worked, what didn't work, what should be kept, changed, or abandoned, and use the new knowledge that we learned to move forward. The number of cycles it takes to fully implement a new procedure takes time. In the beginning, you'll see testing and refining ideas. For some of you, it may take 2 PDSAs before you can move on. Some people, it might take 7 PDSA cycles before they feel comfortable with the testing and refining your ideas, before you move into implementation and the sustaining change. So this is just a diagram, and we will be talking more about this next week, or actually in 2 weeks. In 2 weeks. So again, I just want to leave you with one thought today. Don't obsess in trying to plan a perfect change. This is what PDSA really is all about. Put something on paper, give it a try, study it out, act upon it, and then try again. So don't spend a lot of time in the plan, and then the do. Just do it, study it, refine it, and get on to the next test of change.
Thank you, Debbie. Next, Dr. Oliver will cover learning collaborative data reporting and the data dashboard.
Thank you, Linda, and thank you, Debbie. Before I start in on that, I just wanted to put out a general request to all the sites to please check your phones and make sure they're muted. We're getting a little bit of breakthrough background noise from one of the lines. So if you just double check that, we'd really appreciate it. I'm going to give you a little teaser about our Excel data reporting dashboard, which we'll focus on in the next couple of sessions. So I will, sites, we're still getting background noise, so if you could please double check. Just going to pause for a minute and see if all sites can mute their phones. There's still one line out there that we're getting a lot of background from. Are we able to isolate which line it is? It's the 207 line, or is it the 603? 603. Okay. No, that's us.
I think it's 207-838-9250.
Yeah, that's me. I'm in an airport and I'm on a flip phone. I don't know. I don't have a mute. I can just let Nicole take care of the rest. I'm sorry that.
Hi, Dr. McKay.
Yeah, I'm sorry. I'm stuck in an airport and I have a flip phone, so I'll just sign off and let Nicole take up the rest.
Yeah.
Don't leave us. Stay with us. We'll just let you know if we're getting a lot of background.
All right. Yeah.
Actually, we can go ahead and mute you on our end, so that's not an
okay.
issue. Yeah.
Okay. Thanks. Yeah.
Don't worry about it.
Okay, so we're working on that on our end here. So thank you for bearing with us. So this Excel data reporting dashboard is an attempt to create a rigorous data environment for us that we can use to share our results and improve together and have a transparent environment to study how well we're performing together, but also to do that without driving you crazy at the sites. The idea behind this is that we would send one Excel workbook to each site. Once a month, you enter the data into the spreadsheet and send the whole thing back to us. You keep the original on file and send us the copy. As you enter the data, all of the charts that we'll need automatically are created. So you won't have to worry about plotting graphs or drawing anything. All you do is drop the numbers in and everything else happens. At our level here, we'll aggregate everything together into a collaborative level data environment, and we'll be able to bring that back to you at the collaborative sessions to share how we're doing across sites and as a group together. In red here, I want to emphasize that this is just an intro today. During the next few collaborative sessions, we'll review the different features of this Excel dashboard. The point today is just to let you know that it has been designed and is ready to go, and that you'll be receiving it before the next session. We will send the Excel ahead of the next webinar, and the tutorials we'll do during the upcoming webinars will be recorded so you can review them later, just in case you forget something or need to know what button to push, etc. The first data submission won't be due until the end of May. So we've got at least 6 weeks to work on this and make sure all of your questions are answered. You'll have a chance to play with it and test drive it and feel comfortable with it before you start using it. We're just trying to advance the slide over here. Hold on.
Yeah, that's because we messed with
There we go. Okay. So here's a high-level view of the spreadsheet. Everything will be on one page. These are all the measures for the entire collaborative. On the top part are our outcome measures. You can see that the different visit codes are shown there for each of the AWB outcome measures. What you would do each month is just put a number in there for each one of those. It's a simple frequency count. As you do that, two graphs on the right will automatically generate. It'll give us a big one over there, which stratifies how well we're doing each month for each one of those categories. And the small one to the left of that shows us our total performance over time. And then the next one below that is process measures by phase of the work we're in. So in green there is the first phase of the AWB, the site readiness process measures. In these here, you just enter ones into the categories of things you started or finished, and the spreadsheet does the rest and populates graphs over to the right, showing performance over time. Could you hit advance a couple times? There's a few columns here. Hit it again. Okay, good. And one more time. Okay. Now, it's important to know that these process measures are linked directly to the checklist we'll be working from in the collaborative. So it will crosswalk. The work you're doing will generate the measures you're reporting on. And one more time. And finally, we will color code what you need to focus on as we move through. So you'll notice that for the first phase here, only 2 of the boxes are filled in, the outcomes measures and the site readiness measures. We'll color in other boxes when it's the right time to enter data into those areas. And one more time. Finally, the beauty of this is that when you're ready to publish your papers or present at your conferences, or even if you're presenting your progress reports, you can cut and paste these displays into whatever format you want. Finally, for those who want to get behind the scenes, we'll have a second tab hiding behind the main dashboard. This is optional. We'll certainly use it on our end here, but it will allow you to employ what we call statistical process control, which will help us to see whether what's happening over time is a significant variation or not, and whether changes are statistically sustained. And these displays also could be brought into publications or posters. So you'll have that capability on site immediately when you enter the data. You'll be able to view these things before you even submit it to us. So you'll have this sort of immediate feedback as you enter your data. And then you won't have to worry about a complicated submission process either. You just send the whole workbook to us, and we take it from there. We will talk about basic SPC later on in the collaborative. Don't have to worry about this now, but just letting you know that these are the basic features of the data collection workbook.
Great.
And the rest we'll talk about at the next session.
Thank you so much. I'd like to open the floor up now for discussion. Does anyone have questions, concerns, or anything they'd like to share? Sure. Question. Has anyone done annual wellness visits? And if you have, tell us about that.
So it sounds like everybody is still in the planning phase with the collaborative. Is that correct?
No, I'm unmuted now. This is Joe Decay. I think Nicole probably just isn't speaking up.
Okay, that's unmuted. All right, Dr. Decay, tell us what happened.
Well, we actually did my 95-year-old mother, and Nicole was the prime mover on that. I don't know how she feels about it. My mother said, "I already know I have dementia. Why do you have to tell me again?" But it went very well, and we're going to do another one this coming week. My question, though, to Debbie is, we've recruited a couple of community members. I don't know how they fit into this process over time. Debbie Johnson had said that would be a good thing to do. a little idea as to the structure of that would be interesting to hear about.
Well, what we were talking about is, for instance, during the study and the plan phase, it might be fun for you. Ideally, it's nice to have patients and family representatives right up front in the planning phase. But since you've already implemented this, you would have to get them up to speed. But, you might invite them to one of your practice meetings, Dr. Decay, and update them and ask them, what does that sound like or feel like to you? Do you have any suggestions? You've done an N of one.
Very
but
good.
It is important. The goal is to include patients and family reps during the planning phase as well. But
what we thought
congratulations.
what we thought we might do to start with as well, sort of along those lines, is to have a family member in on the sort of pre-visit questionnaire, so that oftentimes, at least my staff is saying that the patients hate paperwork, and we've got very lengthy checklists. If we don't use the How's Your Health website, that is even more detailed. The How's Your Health website has tremendous volumes of inquiry potentially, and so we thought bringing family members in for the pre-visit questionnaire filling out, if they haven't got it done before they get to the office, have them get there early and then take their feedback and see how they think we might modify the visit preparation in the first part of this anyway.
Could you share what your experience is when there is a family member? I know Dr. Lawrence felt the outcome of the visit was a little bit different when you ask a family member to complete the information. Of course, there are times when the patient can't, but do either of you have any feedback for the site?
Sure, this is Ellen. I think no matter what we do in terms of practice and system change, it's important that we bring in the lens of the patient. Very often what we find is what we thought was the best way to do something really is not. So it's extremely important. And as you will see through our journey over the next year, we not only use patients to help design what we do, but we actually bring them in to help teach as well. So involving them in all aspects of our planning and implementation has been really helpful for us. Dan, anything?
I was a little confused by the question. Is the question when you're doing the health risk assessment, whether you involve family in that?
Yes.
That was part of the question as well. Yeah, so this is Dan talking. So one of the challenges we found is when you have the patient and a family member in the same room and you're asking the questions, the survey takes a lot longer to get through, and you get a lot of conflict between what the patient feels and what the family member feels. So it definitely is a challenge. I'd count on more time. It is good to have both opinions, but it definitely is a challenge.
And I just want to point out that Dr. Decay's practice only did one, and that's all you should be doing for your first PDSA. I think there's a lot of reflection on one, and there's lots to be learned. So congratulations.
Well, thank you.
Anybody else in the study phase?
Hi, this is Rebecca at APD, and I would say that we are currently in the study phase, or need to be in the study phase.
Okay, how's it going?
So we really, I would say we really haven't studied. We've been doing AWVs for about 4 to 5 years, but we haven't taken them apart and figured out what we can improve. So that's where we are now.
Okay. So you're sort of stuck in the do a little bit. So your challenge for the next couple weeks is to get your team together, potentially with a patient or family rep, and study that process. Is it what you as clinicians and staff expected? Is it what you want as an outcome? So great, that's great work.
Thanks.
Anybody else?
So I can tell from the group chat that one site has identified that doing the AWB a couple weeks prior to the provider seeing the patient for their quote annual appointment to review their chronic conditions works very well for them. Again, we've had a lot of feedback on that from different sites identifying the same thing. So can anybody else expand on that if they found the same thing or if they found that more of a challenge?
Well, we had a meeting yesterday. This is Joe Decay. Our office meeting sort of dealt with that issue, which was to keep the annual wellness visits short enough. We'll be needing to again have follow-ups for issues that come up as a result of the annual wellness visit, and then that follow-up visit will hopefully allow more efficient use of time to not get bogged down too much in the annual wellness visit with sort of splitting off a separate exam, which could really tie up the schedule.
Yeah, good.
This is Grant. I've been reading some very interesting chats over here. One from the APD group, and I'm hoping I'm not putting you on the spot too much, but just very impressed at the history that you have doing these AWVs for about 4 to 5 years. And I imagine that you've got some pearls from that experience. What worked, what didn't work? Are there words of encouragement or secrets to pass on to this group that will put them in a better position to succeed based on your experience?
Hi, it's Rebecca again from APD. Yeah, so like I said before, we've been doing them for about 4 to 5 years, but we've really just been doing them. Like we just kind of fit them into our schedule, and we're kind of really busy with them, but we haven't studied them. So that's kind of where we're at now.
Our templates need a little bit of work, I think. So that's one thing we need to do and look at. And I also think we need to look at the process of the risk assessment on our end. The pre-work that they're getting currently isn't the best. So I think it could be a lot more helpful.
Great. Is there anything from your experience that you discovered worked really well?
Like I said, tying them to the provider's appointment seems to work very well as kind of a prep visit for their appointment. I only do 1 a day. We all have a couple providers that we work for, and each nurse sees just 1 a day, Tuesday through Friday. And just because the Monday call volume load is a little much, so we try not to get bogged down with doing visits and the call volume on Mondays. But
that's really awesome that you're doing 1 per day, Tuesday through Friday. How did you carve that into your busy schedule?
We just put it in.
We just did it. We made it work.
Add it on, okay.
I mean, I did.
So you put that into your, go ahead.
I saw a husband and wife actually this morning. I had 2 before lunch today, and I did come back to 12 messages on my voicemail, and that stresses me out a little bit, but I'll manage. I mean, nothing's urgent, so it can wait. So
great. So do you actually put AWB in your schedule or your template?
So
scheduling template?
We have a time in our schedule for 1 a day, built into our schedule, Tuesday through Friday.
Wow, that's really great.
Do you charge for a no-show visit if they fail to appear?
No.
No.
But we don't do that for the providers either.
Thank you very much, APD. I wanted to follow up with Paula Eaton, who's been actively texting back and forth with me about her experience with Maine Primary Care Association. Paula, would you be willing to share a few comments about your experience with the group?
Sure. Can you hear me okay?
Yes, go ahead.
Okay, thanks. So prior to coming to the Maine Primary Care, I was 20 plus years at an internal medicine practice in Bangor, Dr. Charles Berger's practice. We were also part of Martins Point Healthcare. We had implemented the annual wellness visits successfully, and all of the tools that are being shared with at today's discussion was all integral in being able to have a successful program. I can't remember the name of the practice that was sharing earlier, but I believe that in the way that you set up your schedule template is part of the success, where you have a lot of the data collection being done by an RN, and then having the provider do the physical exam and whatever is needed for the appropriate coding was very important in implementing a successful process. My role with the PCA as it relates to this project is really to help the current FQHCs, Nassau and Bucksport Health Centers to help them navigate the PDSAs or whatever tool that they use to help to implement the process for getting this started. And as Debbie had mentioned earlier, it's just a matter of putting the stake, putting a stake in the ground to say, let's just start here. Let's start with one. Let's just start with, an in-law, a cousin, a brother, sister, whatever, and, test it out on them. That's the beauty of PDSA cycles, is to help. It's rapid improvement. It's you do it today and tomorrow you're going to do something different. That's a second cycle. I believe Bucksport, if they're still on the phone, does also have experience with the annual office visits. Annual wellness visits. Deb, are you still on the phone?
Hi, Paula. It's Elizabeth.
Oh, hi.
So we do. Hi. So we do have experience with the annual wellness visit. We did over 500 of them last year, but we are in the position where we want to transfer or transition to a nurse-based visit rather than having the providers do them. So that's our piece of this. We're very familiar with PDSA cycles. We've done them for many other things. So we actually have an internal implementation team, and we're going to meet weekly following this meeting to really sit down and talk about how we implement this. We would like to have our care coordinators doing them so that they can firm up their relationship with the patient, but we don't know whether they will have the time. So we're going to start by having each care coordinator do one. And then we'll kind of go from there and see how it falls out.
Great. Thank you, Liz.
Yeah, I think that's amazing. First of all, that you've done that many of them. I'd like to, perhaps you can share some of your success with us to, what kind of templates you've been using and your success with getting a health risk assessment completed. That's great. But I'm definitely very excited about the switch to a nurse-run visit. And using the care coordinator compared to a triage nurse or a floor nurse, I think is a fine option. Again, most of our care coordinators are pretty busy, and I think the floor nurses have a little bit more time, or the team nurses have a little bit more time. But using the care coordinator certainly to help strengthen that relationship is a great idea. So, good job.
And I just want to comment for those practices that do not have RNs and don't have the capacity right now to make it a sole RN visit, that I am hoping that the other nursing staff are incorporated into the annual wellness visit, and that the data collection is not happening in the exam room with the clinician. Anybody else have any experience or pearls you'd like to share?
Hi, so this is Elizabeth again from Bucksport, and I just wanted to respond to that comment about the other nursing staff. Currently, our providers are doing the annual wellness visits, but our MAs do all of the data collection. I'm not sure we could do it if we didn't have that in process, and that's really what makes it go so smoothly right now. So, but we are having some capacity and access issues, so we want to try and transition those over to the RNs and see how it goes.
Great, great.
You know, not only in access, you're definitely going to gain that access if you move that visit to an RN, but think of the revenue as well, right? So now you're going to take some of that, you're going to have your nurses making money, but you're going to open up all those spots for the physician to bring sick people in and help the sick people and really increase that access. So I think taking that additional step, even if it ultimately means hiring a nurse, I think we could help show you that the data supports that extra additional income that you'll make and how much you can open up that physician or nurse practitioner or whoever, it is huge.
Right. Thank you, Dan. Thank you, everyone. I guess in summary, before we move on, I think we realize we have a diverse group here. APD has done a lot of them, so I would like to encourage you, before you do too many more, to pause and really study what's working and what's not working and how you want to refine the process. And Dr. Decay, it sounds like your practice is well on to refining and you're getting ready for your next annual wellness visit. For those of you that are still in the planning phase, I'd like to challenge you before our next call to have a date to test one annual wellness visit, and hopefully maybe even done one annual wellness visit. But that's the challenge from me, that you, after this meeting, if you don't have a date for your first annual wellness visit, that you can get out of the planning stage and set a date. Very good. Thank you all.
Thank you.
Hold on, I'm just going to advance there we go. So I wanted to just very briefly touch on what's next. Our next collaborative call is on the 3rd of May. We'll be again looking at pre-visit site readiness and reviewing of the site readiness checklist, and talk about, get some updates from you all, see how things are going. And also, we'll have PDSA Part 2, Complements of Depth. The first monthly data, again, is going to be due on the 31st of May. I put here, I can't open it within the Zoom platform, but again, attached to your invite today is the link for the post-webinar survey. Please click on it. It will take you a minute or two to complete, closer to a minute, really. And the other thing I wanted to mention is that we are going to be adding a tab on our website for the Learning Collaborative, and there you'll find documents, the worksheet that we provided, the syllabus, these recordings from these webinars will be there, as well as PowerPoint, so you'll be able to access that material there. And on that note, I wanted to thank you all for joining us, and
we're done 3 minutes early. Plenty of time to do the survey.
So do 2 surveys. Thank you all for joining. It's a great pleasure meeting you, and for someone who's done collaboratives for many years and many places, this was a really strong first session. So very nice job, everyone, and looking forward to seeing you next time.
Thank you.
Take care, guys.
Bye-bye.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Bye. Bye-bye.